Vidhi, we have to move ahead because we are also on Facebook Live. I don't think so. We should be delaying further. Please take this ahead with the president and let's. President is there with us. Yes, hi, President.
Yes.
Shall we proceed further now because we are already on Facebook Live. Vidhi.
President, can you start with introduction?
Is Caroline one more? Hi, Caroline. Are you also a president of one more club? Yeah, you are muted right now. I think so. Our president from the club is not in range. Would you like to initiate the talk? And carry on. You are muted. You are muted, Caroline. You are muted.
Okay. Okay. I wanted to say that. Can you hear me?
Yeah, you are very well audible.
Okay. So I wanted to suggest that we should introduce ourselves individually.
Yes. Why not?
Then
we should do that.
We can come in. Okay.
So why not we start with you?
Okay. Thank you very much. It's a pleasure to be here. It's nice meeting Rotarians from other parts of the world. My name is Caroline Modupe, and I'm the president of the Rotary Club of Abak Metropolis. Now, Rotary Club of Abak Metropolis was chartered on the 7th day of April of June 2011. So far, we are a small club of about just 11 members, though we have some other new members people have indicated interest to join us. So hopefully before the year runs out, we may have more people who will also be part of our club here in Abak Metropolis. It's one of the clubs in District 9142. Thank you.
Thank you, Caroline. So, Caroline, I'll introduce my team over here. We have on the screen Sneha Salian. She is our chief nutritionist, and she's been doing a lot of work in the field of obesity care. We have, along with her, we have Dr. Manish Motwani. She's a leading gynecologist in Mumbai, and she has been practicing gynecology since almost more than 2 decades. Then we have here Dr. Lotika Purohit. Dr. Lotika, can we have you on the screen, please? Dr. Lotika. So Dr. Lotika is a very senior diabetologist and an endocrinologist in Mumbai, and she's working with some big institutes, and she has been doing a lot of work in the field of diabetes care. And here am I, Dr. Manish Motwani. I am a metabolic and bariatric surgeon with Breach Candy Hospital and Asta Bariatrics. And the person who has been responsible for carrying out and organizing this entire show is Vidhi Jain. And Vidhi is our coordinator for international coordination. And she has been taking up this project so well. We've already done a lot of projects in Kenya, Nigeria, Nepal, Sri Lanka, Bangladesh. And we plan to take obesity care and obesity prevention to almost every corner of the world. So This is our team. I would also request President Ekere to also come ahead and introduce herself. And we also have Dr. Ekpan, if I'm not mistaken, to come out and speak something. And once that is done, we will go through the national anthem of your country and probably then start with the event immediately. I think so. They're not around. So why don't you take over, Caroline, from here onwards till the time President joins in, and then we allow her to come and speak. I believe she is president from Ecot Equine Metropolis, right?
Yes, she is.
So let's take the next step rather than waiting, because we are already on social media. We are on a Facebook Live. So we should move ahead, I feel.
Vamos.
President Caroline, can we take this further ahead? With some network issues, I believe, today, which is not allowing them to go ahead as planned. Can you interact with presidents to ensure that we don't wait longer and we can go ahead with the talk too, please?
Sure, sir.
Yes. I'm in a meeting. Hello.
Hello.
Okay, I just spoke with President Ekere now. She said that she's trying to speak, but she's not being heard, but she hears everything that we are saying. So I'm suggesting
shall we
maybe
proceed further?
Yes, let's proceed further. Yes, please.
Yeah. Okay. Yeah, Vidhi, please go ahead.
So I would first like to introduce myself. Hello, everyone. My name is Vidhi, and I am a clinical nutritionist at Astha Bariatrics, and also an international coordinator for outreach programs in Nigeria and Kenya. So in today's discussion, we are going to discuss one of the most growing concerns, and that is obesity. So the issue that has been growing to epidemic proportions, with over 4 million people dying each year due to being overweight or obese. So obesity is one of the most ignored diseases in the world. And the number of people with obesity is increasing every year. And there is a lack of awareness about obesity, leading to various physical, medical, and psychosocial problems, including breathlessness, heart problems, snoring, disturbed sleep, sleep apnea, infertility, etc. Though physical disability and medical issues are very common, but one of the neglected issues is psychosocial issues, causing decreased confidence, low self-esteem, and productivity. But the only solace is that when a patient manages to lose weight, these medical issues also tend to reduce. That is the reason why we have taken up this initiative under the Rotary banner to bring about awareness amongst the community and train and guide them into a healthy living. So, today to discuss obesity, its associated medical problems, its prevention and management, we have arranged this panel discussion of experts who will put their senses on this dreaded disease. Let me introduce the panelists for the day. So I would first like to welcome.
Vidhi, I think so. We've already done that introduction part. We can directly go on to the topic because that part is already taken care of.
Sure.
Oh, I think I'm back.
Yeah, welcome, President. Finally, you're with us.
Thank you.
So, shall we, with your consent, shall we start with the panel discussion? Or you want to carry on with some formalities, which we don't mind if you spend 2 minutes on? Do you want to do any formalities from your club point of view, or you feel we should proceed?
Oh, let me introduce my club. My club is a Rotary Club or Ikorekpene Metropolis, and it was chartered June 21st, 2001. And currently, we have about 11 members, and then we are still looking at expanding our membership base, because we are still doing programs and we hope to have more members joining us. Thank you.
Thank you. So, President Ekere, we are also, my club was also chartered in June 2001. So,
wow.
There's a lot of common between your club and our club. And I will be taking over as the district governor nominee in 25-26 for Rotary 3141, that is Mumbai. And we are so happy to get associated with such lovely clubs from all across the globe, from across the Rotary world. So, absolute pleasure. So, Vidhi, now I feel with the President's consent, you can move ahead and we can start with the panel discussion.
Okay. So, starting with the discussion, I would first like to ask Dr. Manish that one question that always comes up, that is, how does one become obese?
Vidhi, this is a very pertinent topic and a very pertinent question. Obesity is a huge medical problem. And obesity is one of the commonest medical problems today. If it's a commonest medical problems, then there has to be a common reason why so many people become obese. So a simple formula is that when energy coming into the body is more than the energy spent, obesity comes in. So when I speak about energy coming in the body, that means about what we are eating, how we are eating, the method. And when I speak about energy going out of the body, it means physical exercise. So if our eating patterns are not so good and there is no good method of losing calories by physical exercise, yes, obesity comes in.
Thank you so much, sir. So I would also like to ask that obesity, is it a huge problem or is it being blown out of proportion?
Obesity is definitely a huge medical problem. It is not just about not being able to wear the type of clothes you want to wear. It is not just about some physical discomfort. It is not just about not being able to conveniently move out because of some physical disturbances. Obesity is much more than that. WHO in 2017 has said that obesity is the #1 killer in the body. Today, 68% of diabetics are obese. Almost 70% of high blood pressure patients are obese. Almost 85% of sleep apnea patients are obese. Obesity causes heart diseases. Obesity causes infertility. Obesity causes cancers. So when obesity is the root cause of so many medical problems, I feel definitely it should be considered seriously, and obesity should be considered as a huge medical problem. But it's not just the physical problem or the medical problem. It also causes a lot of psychosocial problems, because of which a person loses confidence, decreases productivity, and and decreases productivity, and we see that the person is not performing at his best. So yes, obesity is a huge medical problem, not blown out of proportion. In fact, we lack the type of awareness we need. So it's high time that clubs like our friends clubs who have participated or partnered with us, we should have many more clubs and many more members coming out and taking this responsibility of spreading the message all across the community.
Thank you so much, Dr. Manish, for your insights. Obesity is indeed a complex and a multifaceted issue. We just also heard Dr. Manish just say that obesity causes for infertility as well. So why not ask this question to Dr. Mahek? Dr. Mahek, I would like to ask you that what, according to you, are the risks associated with obesity in women?
So apart from risk factors of obesity in general population like heart disease, diabetes mellitus, hypertension, women, those who are obese, have other risk factors. Like they come to us with a problem of menstruation, that is, they have irregular periods, or they will have less flow. These all things are associated with a condition called as a PCOS or a PCOD. Then a big problem in these patients is infertility, that is difficulty to conceive. And even if they conceive, if they are obese and even if they conceive, the chances of abortion and then or a recurrent abortions are very, very common in these patients. As well as pregnant patients who are obese have high risk for developing gestational diabetes, that is pregnancy-induced diabetes, pregnancy-induced high blood pressure. They might have macrosomia or big babies. Also, they are more prone to cesarean deliveries. Apart from all these things, obese women are also prone to have or high risk for endometrial or uterine cancer and a breast cancer. So these are the high risk factors in the women who are obese, apart from other problems they have because of the obesity. So it's very important to, go ahead and explain the female, those who are obese, about all these problems.
Thank you, Dr. Mehek, for outlining the risks related to obesity. In that case, what is the impact of obesity on infertility or PCOS?
Okay, so let me explain PCOS in a very simple language. So what is PCOS? P stands for poly, means multiple. C stands for cyst. Cysts are like these water-filled bodies. And O stands for ovary. And D for disease. So polycystic ovarian disease means lots of water-filled, like a bubble things in the ovary. Now, why they are caused? It is because of the hormonal imbalance in the body. Now, those women who are obese, so they have increased number of fat tissue in their body. So this increased fat tissue produces a estrogen hormone in a very, very high quantity. So this excess amount of androgen or estrogen production causes or prevents egg to be released from the ovary. And so these eggs accumulate water and form this small cyst. And so with a history of like 2 years, 3 years, 4 years, these small cysts accumulate in the ovary and also damage the ovarian function. Now, other important thing because of these PCOS people suffer from irregular menses. Then they might have less flow. They will have anovulation, that is, the egg will not get released from the ovary. They will also have other problems like facial hair, acne, baldness, a male pattern baldness, what we say. Not only PCOS, these people also suffer from infertility, like a difficulty in conception. So this is because of the anovulation. As the egg is not released from the ovary, or the egg is not mature, or the egg is very weak. So these females do have a high chance of infertility or difficulty in conception. The other factor, apart from the increase in the hormonal production, is the insulin resistance. Very, very important factor. Because of the obesity or the fat tissue, these people do have this insulin resistance. That is, lots of insulin is accumulated in their body. I think Dr. Lotika will definitely lighten about these the high levels of insulin in the body in the obese people. Because of that, also there is a high production of androgen or estrogen, which again leads to PCOS, infertility, and many more problems in the obese females.
That was quite an detailed explanation, Dr. Mahek. Uh, Moving ahead, it was also previously mentioned by Dr. Manish that obesity it has also a huge impact on diabetes and is also one of the most common issues today. So why not ask Dr. Lotika? Dr. Lotika, my question to you is, how does obesity increase the risk of developing diabetes?
So, yeah, thank you for inviting me for this webinar. And it's good to be able to share information with people from a different continent. Yes, we started with obesity and insulin resistance. So basically what happens is that the pancreas, which secretes the insulin, because of the excessive weight, it does not work as well as it's supposed to. And there is resistance to that, and this resistance further increases the weight. So it's like kind of like a vicious cycle, and at some point of time the pancreas just stops secreting any more insulin, and that's when the blood sugar levels start to go up. This is usually what we call type 2 diabetes, which occurs in maybe people in their 40s, 50s. However, now we are seeing with the increase of obesity in the younger generation, we see even people at the age of 15 and 20 having a type 2 diabetes. In this, the problem is that, besides having elevated blood sugar levels, there is a lot of inflammation in the body, which is usually a low-grade inflammation which is there. And this also disrupts the insulin and the insulin responsiveness of the cells. Besides this, we also find that they have elevated levels of triglycerides which are there. So there are multiple problems that do occur because of the excessive weight in people with diabetes.
We do agree, Dr. Lotika. So in that case, like what type of diabetes is most commonly seen in obese patients, and what is the reason behind it?
So most commonly, like I said, it is type 2 diabetes which occurs in these people. The reason behind it is the sedentary lifestyle, the eating habits, lack of exercise, and also in some people, because of use of addictive substances, also there is some element of weight gain. Besides this, of course, the genetics also does play an important role. And, there are people who are genetically predisposed to having obesity. But most common, it is found that, a diet which is rich in sugars and saturated fats is also responsible for this excessive weight.
Thanks, Dr. Lotika, for shedding light on this topic. So my next question is to Dr. Manish. Dr. Manish, you come in here with a lots of experience. So kindly help us understand that how do you treat obesity?
Friends, as I said, that obesity is a huge medical problem, and every medical problem requires a scientific solution. Scientific solution is based primarily on the basis of the severity of the medical problem or intensity of the medical problem. You all will agree, probably treatment for a 99-degree fever and 104-degree fever is different. Treatment for 170 sugar and 320 sugar is different. If you give a treatment of 99-degree fever for a patient who's having 104-degree fever, you will have some response for some time, but as soon as the effect is gone, there is going to be fever that is going to come back again. Similarly, the treatment for sugar, if you don't give the right treatment at the right time, you are bound not to get the type of results that you wish to have. So one thing is very clear, that obesity being a medical problem, it requires a scientific solution. Scientific solution is based on severity, And severity is determined on the basis of BMI. BMI means body mass index, which means what is your weight with regards to your height. Now, as per this BMI, anyone who is normal weight is usually given diet to maintain that weight or reduce the weight by 3 to 5 kgs. Suppose a patient is 3 to 5 kgs overweight and we give them diet, they will reduce the 3 to 5 kgs and they'll be able to maintain the lost weight also. But even if the person is just 10 kgs overweight, then diet is probably not the line of treatment. If for once the patient puts in all the efforts and reduces that 10 kgs, the person has lost 10 kgs, will increase 15 kgs because for 10 kgs, diet was not the line of treatment. So similarly, a person with 25, so anyone who is less than 25 BMI is normal weight, 25 to 29.9 BMI is overweight, 30 to 34.9 BMI is grade 1 obese, 35 to 39.9 BMI is grade 2 obese, and more than 40 BMI is grade 3 obese, or which is also called the highest level of obesity. So for normal weight, we give diet. For overweight, we give diet plus exercise, gym, yoga, balloon, injections, medicines. So the purpose of this event today is to ensure obesity awareness is created so that we don't allow people to go into obese category, because once you go more than 30 BMI, then the treatment options become very limited and the treatment becomes only bariatric surgery. But if we have a patient who's less than 30 BMI, then why not give our best? Why not try to take efforts on prevention? Why not try to take efforts, concrete steps to ensure that the person maintains in the normal or overweight category and doesn't go into obese category? And for this category, there are multiple options. You can have diet, you can have gym, yoga, exercise, lipo, liposuction, tummy tuck, injections, medicines, lifestyle modification, behavior therapy, so many treatments that we can do for patients who are less than 30 BMI. So our idea and concept is, don't let yourself go into a BMI of more than 30, be into a BMI of less than 30. If you're in a BMI of less than 30, you're supposed to do very small, simple steps. Of course, we have with us nutritionist Sneha, who will elaborate a bit more further on this, but I would like to give you all a few important steps, few important guidelines. So it is usually not about what you eat. It is about how you cook, how you eat. So what is more important is you need to do multiple small meals. Then when you have small meals, you should have meals every 2 to 3 or 4 hours. So that means you do not have long fasting periods. You should snack between meals. You should have good portion control. You should have every constituent of food like proteins, carbohydrates, fats, vitamins in every meal. You should ensure that you don't have anything, and everything you eat should be in moderation. You should also ensure that you have good amount of water a day. And most important thing is some physical exercise every day. So if you are less than 30 BMI, I'm very clear in what I'm saying. If you're less than 30 BMI, that means you have not gone into obese category. Then you can do lots and lots of things to ensure you don't go into obesity. And if you are not entering obesity, you have very good methods and simple methods in which you can maintain your weight for years and years to come. Vidhi, what I would request you is if you could just put in the URL of Asta Bariatrics BMI chart on the Facebook Live and also on the Zoom chat. I think so people will be able to go ahead and see their BMI and they'll come to know whether their BMI is less than 30 or more than 30. But if the BMI goes more than 30, yes, the treatment options are very limited and then the treatment becomes only bariatric surgery.
Uh, Thank you, Dr. Manish. That was quite insightful. I think the information you just shared will help many of the viewers to make informed choices in the future as well. Uh, I would now like to ask Dr. Mahek. Uh, you would be coming across various obese infertile and obese unmarried. So, does weight loss impact their disease status too?
Okay, so in our practice, we get lots of females, those are obese, coming with lots of problems like menstrual irregularities, PCOS. Also, the females those who are infertile or they have difficulty in conceiving, the main advice for both these types is very, very important to reduce the weight. Because if they reduce the weight even by 5 to 10%, their fertility improves as well as the menstrual irregularities are improved. Now, what happens whenever the fat tissue in the body is reduced when they do a weight loss? So, excess production of the hormone like estrogen is reduced, insulin resistance is reduced, which in turn causes hormonal balance or restores the hormone balance in the body, which in turn helps in giving a good ovulation as well as a production of mature eggs rather than the immature or a weak eggs. And definitely this improves the fertility levels. Not only the fertility, but also their menstrual problems are, taken care of, as well as their another problems like, high risk to the other factors is also taken care of. So reduction of weight is a main advice what we give to these type of patients. Either they are coming with the PCO or infertility, and it really helps. We have seen in our practice because when they are obese, even our medications sometimes fail to give support or help in these infertile patients because of the weak eggs, lots of weak eggs produced in these females. Even if they conceive, sometimes they have a high chance of abortion. So reducing weight is very, very important, even if there are lots of high-end treatments available in our faculty, in our gynecology.
In that case, what would be the ideal patient treatment pathway for an obese infertile or an obese unmarried?
So as I told you, in both these types, weight reduction is very, very important. And then we might tell them to, go for certain types of treatments. But weight reduction is a main important thing. I have seen in our practice that whenever these people, when these females reduce the weight, they definitely have a good outcome with even little support or little medication. But even if they don't reduce their weight, even like the high end treatments like IUI, IVF also sometimes fail in these treatment in this type of obese females. So weight reduction, yes, it helps along with a little support.
Thank you so much, Dr. Mehek, for sharing this information with us. It is clear that weight loss plays a crucial role in managing both infertility and also the overall health for an obese individual. Now coming back to Dr. Lotika, I would like to ask you that
Yes.
have you seen a good response in an obese diabetic with weight loss?
Oh, yes, definitely. Once the weight starts going down, there is a significant amount of improvement in the insulin sensitivity. As the insulin sensitivity improves, the insulin resistance reduces, the blood sugars start coming down in control, and so therefore the patient's well-being improves. They are able to take better care of themselves. They enjoy a better quality of life once they start losing weight. Besides this, of course, some of them do not even require medications to be given slowly and surely as the weight starts coming down.
Great to hear about the benefits of weight loss for an obese diabetic. Thank you, Dr. Lotika, for sharing this perspective with us. So, friends, noted as a consensus statement that obesity is a huge medical problem, and WHO has pronounced obesity as the #1 killer. So, as I said earlier, that it causes physical, medical, and psychosocial issues as well. But if the right treatment is given to the patient at the right stage, at the right time, not only does weight loss happen, but along with weight loss, medical problems also resolve. So patients with a BMI less than 30, along with medical issues, for them, diet, exercise, and lifestyle modifications plays a vital role. For patients with a BMI greater than 30, Irrespective of their age, gender, or marital status, bariatric surgery is the key. So now I would now like to move on to our clinical nutritionist, Ms. Neha Salian. So Ms. Neha, I would like to ask that we have a patient who has a BMI less than 30. Then how can we achieve a good weight loss?
So for somebody who is less than 30 BMI, we should be looking first and foremost at the, right kind of balanced diet or balanced meal where portion control is the key. A balanced meal is nothing but dividing your meals into proper amount of food groups. So whenever we look at a food plate, half of your plate should be fiber, that is your fruits and vegetables. 1/4 of your plate should be your fuel, the source of fuel, that is your carbohydrates, your grains, and 1/4 portion of your plate should be filled with proteins, which includes dairy, which includes meat, your pulses, lentils, basically. So if you're having a right balanced meal, 99% of the problem is solved, wherein you ensure good amount of nutrients in the right quantity. When I talk about portion control, something that we usually tell all our patients is eat till you are around 70 to 80% full, because when you leave that room of around 20 to 30%, you also leave a chance to feel hungry again after some time. You're not overeating, and then you are able to consume small but frequent meals. So small and frequent meal pattern is very, very important in order to maintain a good energy balance and a good healthy diet as well. Right kind of snacking options like fruits, yogurts, nuts, seeds, milk, protein based stuffs, basically, as Dr. Manish also mentioned, is very, very important, because when you are eating multiple times, it doesn't mean that you always have a proper meal. It is necessary to choose the right kind of snacks during these mid meals. Apart from diet, what is important is your exercise. Whenever you are consuming calories, spending them out is also equally important. So energy output has to be in line with the energy intake. So 30 to 40 minutes of any form of exercise is very, very important, not just for the energy balance, but it is important for your mind, it is important for your heart and your overall strength, basically. Something that we usually say, keep away from the three whites, that is refined flour, sugar, and salt, the three most dangerous food products that we consume, which is really, really very harmful for us. So this is going to be a take-home message, that please keep away from the three whites. Apart from this, the most important thing, or rather the most ignored thing, is hydration. Hydration is very, very necessary to have a healthy body, because our body is 70% fluid. Our enzymes, our hormones, our blood flow, everything is basically fluid. So if your hydration is not up to the mark, you're not going to be optimally functioning. Your body is not going to be functioning to the mark, and you will feel dizzy, or you'll feel tired or lethargic during the day. So yes, hydration is very important. Now for people between around 25 to 30 BMI, which we call it as overweight category, sometimes diet alone cannot work, obviously, because diet can be a good way of managing weight when you are just 3 to 5 kgs overweight, below a BMI of 25. So for somebody who is in the range of 25 to 30 BMI, along with diet, you do need additional therapies like liposuction, gym, exercise, yoga, medicines, meal replacers, etc., which will aid in the process of weight loss. I hope that answers your question.
Thank you, Ms. Neha. That was quite informative. I would now like to come back again to Dr. Manish. You clearly said that anyone who has a BMI more than 30 will need bariatric surgery. So can you throw some light on what is bariatric surgery, and are there any risks that are involved?
See, bariatric surgery means any surgery meant at major weight loss. So as I said, let's recap the entire thing. Obesity is a medical problem. Every medical problem requires a scientific solution. As per the scientific solution, anyone less than 30 BMI is supposed to be normal weight or overweight, where we have all the conservative lines of management. But once the BMI goes to more than 30, the patient enters into obese category. When you enter into obese category, yes, bariatric surgery is the only solution. Some people used to feel that, oh, bariatric surgery is very dangerous. Friends, obesity surgery or bariatric surgery or weight loss surgery is 100% safe, 100% reliable, hardly any side effects, no complications. It's a time-tested procedure where the patient gets some phenomenal, extraordinary good response in weight loss. The best part is not just the weight goes down, but the medical problems which have come because of obesity, like diabetes, blood pressure, heart diseases, also decrease. Breathlessness decreases. A patient who was not able to walk 10 steps without being breathless now can walk for 7 kilometers. A patient who was having severe knee pains now can run around. Person who was not able to sleep or was snoring very badly in the night and had to get up for urine multiple times because of obesity or having choking sensation or heaviness now can sleep so well. So yes, bariatric surgery is a scientific solution to medical problem called as obesity. And these bariatric surgeries are carried out through laparoscopic procedures, multiple small holes, no big cuts. And through these small holes, the surgery is done. Surgery is such that we operate the patient in the morning. By evening, the patient is taking 20, 30 rounds in the hospital. Next day, the patient goes up and down the stairs. So very time-tested methods. We operate patients right from a 9-year-old to 77-year-old. Absolute 100% safety, no issues at all. And one more thing that is very important, that whether it is an unmarried girl, unmarried boy, even for those patients, this surgery is extremely safe, in fact, very helpful. I would also like to show you a small demonstration of a video. Vidhi, I'm just showing that video. Let me know if it is seen well.